After reviewing this podcast, your module, your textbook, you should be able to identify important information on the insulin labels, identify various methods for insulin administration, be able to read the calibrations on a 30, 50, and 100 unit syringe, measure insulin in single dosages, measure combined insulin dosages, as well as calculate dosages for U500 and U100 insulin. Thank you for joining me. This is Susan Knowles with Cochise College Nursing. Insulin is a natural hormone secreted by our pancreas. However, administration of insulin is used to control blood sugar in people who cannot produce enough insulin. Either they don't produce any at all or they don't produce enough. Dosages are measured in units, typically using U100 syringes with U100 insulin. Rarely U500 is used, but that's with people who have marked insulin resistance, who require high dosages of insulin, something greater than 200 units per day. There is a safety alert. Accuracy in insulin preparation and administration is crucial. Inaccurate dosages can lead to serious or life-threatening events. In this slide, I'd like to review some of the common mistakes that can be made with insulin administration. Either incorrect rates are programmed into an insulin pump, inaccurate concentrations of insulin is used to prepare the dose, or the use of an insulin syringe to prepare a non-standard concentration is used. Use of a tuberculin syringe to prepare the dose instead of a insulin syringe. There are some look-alike names and packages, so that's an alert to make sure that you are actually getting the correct type of insulin. There could be a miscommunication of an order, or an U is read as a 0 instead of units, and that's the reason why we don't use the U any longer, but you need to write the entire word out. Or maybe insulin is given to someone who's not a diabetic, and so now they have what's called profound hypoglycemia, such a low blood sugar that could kill them. Another safety alert. Just to remind you, U100 equals 100 units per 1 ml. U500 is 500 units per 1 ml. U500 insulin is 5 times as concentrated as U100. Therefore, it is crucial to use extreme caution when administering U500 insulin to prevent unintended overdose, which we've mentioned before can result in either irreversible insulin shock or death of the client. Let's talk about the rapid-acting insulins right now. We have both rapid-acting and short-acting. And if you'll look at the packaging here on the slide, you'll notice that the rapid-acting is called Humalog, or the trade name is Lispro. You give it about 5 minutes before a meal, or a patient gives it to themselves. It is subcutaneous. They can be given IV, but this year you'll be concentrating on the subcutaneous types of insulin. Short-acting insulin is something that's called regular. It has an R on the box. It's Humulin, and it is clear. All of these are clear. They can be given, as I mentioned, subcutaneous or IV. However, we'll be concentrating on the subcutaneous. You'll see that the rapid acting is given about 5 minutes before a meal. And then you'll notice the R on the box of regular insulin, and then you'll notice that the rapid acting has no R on it, and it's called Humalog versus Humulin for the R. The rapid-acting insulin has about a 15-minute onset. Its peak of action is somewhere between 30 and 90 minutes, and it lasts, or its duration is about 3 to 5 hours, whereas the short-acting insulin has an onset of about 30 to 60 minutes after administration. Its peak is somewhere between 2 and 4 hours. You can see the difference between the two. Rapid is 30 to 60, whereas short-acting is 2 to 4 hours. The duration for the short-acting insulin could be up to 8 hours. It's between 5 to 8 hours. So when you compare the rapid to the short, the duration of a rapid-acting is somewhere between 3 to 5 hours, and the short-acting is somewhere between 5 to 8 hours. Now let's look at the intermediate type of insulin that we call NPH. Here's a couple of examples that you see on the screen. You'll notice that there is an N on the box. That stands for NPH or Humulin N. It is a cloudy insulin. You can mix it, and oftentimes it is mixed with a rapid acting, or most likely with a short acting like regular. We'll go over the steps of how you draw up insulin, but basically you draw up your clear before your cloudy. It has an onset of about 1 to 2 hours, has a peak effect somewhere between 4 and 6 hours, and a duration of around 12 to 16 hours. So when you start thinking about mixing it with a short acting, you can see that the short acting will work somewhere within that first hour to 2 hours. It'll last a little while through as it's working with NPH to control the blood sugar. Now let's talk about the last type of insulin that's a single drug in a vial, long-acting insulin, or L. There's two basic types on the market, trade names that are on the market, Lantus and Levemir. They are both clear, so you do not want to get them mixed up with regular insulin. They cannot be mixed with any other kind of insulin. They do not have a peak of action. They last for 24 hours, and they need to be given at the same time of the day. Now, in Levemir, some people may need to have 2 daily doses, but generally speaking, these are long-acting insulins that last for somewhere between 20 to 26 hours. And here is an example of a box which shows the label of Levemir and Lantus. On this slide, I just wanted to compare and contrast the 3 different types of insulin. On the screen currently, you'll see you have the clear insulins, which are short-acting. You have Humulin R, Humalog, which is Lispro, Novolog, Aspar, and Pidra, which I haven't seen before. I've seen the others more frequently. All of these are short-acting insulins. You have cloudy insulin, which is your NPH, which can be mixed with your regulars or your short-acting insulin. And then you have your next category, which is your long-acting insulin. It cannot be mixed with anything else. There are some fixed combinations of insulin that are pre-mixed, if you will. So the popular ones are here on the slide. You have Novolog 70-30, you have Humulin 50-50, you have Humalog 75-25. What this means is that something like 50-50 of 50 of regular and 50 of NPH. The Novolog, where you have 70-30, you have 70 units of NPH and 30 units of regular. So it's important to remember that the first number of the fraction is the NPH and the second is the regular. And it gives you an example here on the slide. If you have Novolin 50-50, what that means is you have 50% is NPH with 50% regular. So if a client has a dose of 12.5, as the example is here, they're actually getting, or excuse me, 25 units of Novolog, they're actually getting 12.5 of NPH and 12.5 of regular. It's the percentage of insulin that's actually in the syringe. Now here I want to go over the insulin syringes. So those of you that have an insulin syringe at home, you can take a look at your own insulin syringe to see whether or not you have a low dose syringe, which may be this one that has 0.5 mLs with the capacity of 50 units. I don't think anyone picked up the smaller syringe, which actually only has a capacity of 0.3 ml or 30 units. And then you have the other two types of syringes. You have the one that has a capacity of 100 units. It's a 1 ml syringe with 100 units of insulin. Or you have the fourth type of syringe, which is one that has, it's a double scale syringe. So it actually goes, is marked with every single unit. So you can go all the way from 1, 2, 3, 4, 5, 6, 7, 8, 9. And so you have your even markings on one side, your odd markings on the other. It makes it very convenient for measuring an odd number of units of insulin. I thought I would review U500 insulin again. Remember, that's 500 units of insulin per 1 ml. You need to check the insulin label carefully. If you have any uncertainty or about this drug, you need to clarify it. Never assume. Check your calculations and your preparation with at least one other nurse so that there are two nurses looking at the medication. Educate the patient about the U500 insulin as well as the dosages. And this U500 insulin is the exception because we usually say U100 insulin is administered with U100 insulin syringes only, never with any other kind of syringe. However, the exception to the rule, once again, is the U500. You use a 1 ml syringe versus a insulin syringe. U500 insulin, very important to read the label. Notice the red high potency warning on the label. You'll see that it is U500 and it says Humulin R. Now, doesn't that look good? So now that wants to confuse us with our rapid short-acting insulin that's our regular insulin. However, according to the research that I have found, this insulin acts more like NPH versus regular insulin. So here's our exception to the rule when we go to calculate insulin. Normally you do not have to do any calculations with insulin. You just give the ordered dose. However, with U500 insulin, it will be ordered with a specific number of units. And here we have an example, Humulin regular U500 insulin, 155 units. So you'll have to use your formula that you use to calculate a dose with desired over half to find out how much you would actually administer in the syringe. And the answer is given to us here that when you do the conversion, it comes out to you have to give 0.31 mLs to the patient, which would then represent 155 units of insulin. I wanted to go ahead and give you an example of two syringes. And you see here that if you use a regular syringe here, more than 1 ml syringe. This is a 3 ml syringe. The closest I can get is about at 0.3. I can't get our answer of 0.31. Whereas in the second syringe, you can see that I can actually get 0.3, and then this arrow is up a little high. I would move it down just a bit to get it at 0.31. Alternative delivery devices for insulin are listed here on this slide. You'll see there's two. We have the insulin pump. This is for a continuous 24-hour-a-day delivery of insulin via a small needle placed under the skin, and the insulin is delivered through a small catheter. And the patient can actually bolus themselves before meals. So they'll have a continuous delivery, and then prior to meals, when they check their blood sugar, if they decide that they need to have a little bit more insulin, they can dial in a little bit more with their pump and give themselves what we call a bolus. The insulin pens are exactly what they look like here with the blue arrow, and they are, as I mentioned to some of you in class, there's a little dial. You dial in the dosage that the patient requires, and then they just stick themselves. There's a small retractable needle in the pin, and they can carry that around very conveniently. Let's review real quick on insulin orders. Very similar to any other medication order, except you need to make sure that you actually know the brand name of the insulin that is ordered. You need to know the number of units that needs to be administered, the route, which normally is subcutaneously, but there are occasions when patients are given their insulin in an IV continuous drip. Those are usually for very sick patients. The time it's to be administered, and the strength, U100 or a premixed of 70-30, as we mentioned before. And of course, there's one more exception to this, or one more option, which would be U500. Again, never use the U because it can be misconstrued as a 0. Now let's talk a little bit about coverage, or a sliding scale. There are still patients you will find in the hospital that will be given correction insulin, if you will. So insulin that is given based on the patient's blood sugar. So the patient will have a finger stick done before a meal typically, and based on that blood sugar, there will be a scale that the nurse will follow to go ahead and administer the insulin to the patient. And you need to know if the provider wants to use a standardized sliding scale or if there's one individualized to that particular patient. And again, so that's based on the finger stick blood sugar. If it falls between, let's say, 241 and 300, then the patient will be given 4 units subcutaneously of a, generally speaking, a regular insulin, or it could be a rapid-acting insulin like Lispro. You may find that sliding scale insulin orders are not used as frequently in the future. I'm pretty sure you'll probably, as students, be seeing it. You may still see it as a registered nurse. However, they are not felt to be as effective as treating blood sugar before it becomes high, because this is largely ineffective because it treats hyperglycemia after it occurs rather than preventing it. So that's what the goal is today. So we're going to go over the method of drawing up 2 different kinds of insulin in one syringe. We're not going to be lucky enough to always have patients that fit within the pre-mixed insulins like 70-30 or 50-50. So here are the general rules. Always draw up the regular or the short-acting insulin first, so that's clear. Then draw up the cloudy or the intermediate-acting insulin. So the insulin that is to act first is drawn up first. So that's one way to remember which one goes first. The other phrase is clear before cloudy. You mix only the same types of insulin, such as Humulin R with Humulin N, or Novolin R with Novolin N. You never mix Lantus or Levemir. They are clear, but remember those are your L insulins. Lucky they start with the word starts with L, but those are your long-acting. They never get mixed with anything. So always check each step to verify the dosage with another nurse. So let's go over the procedure for drawing up 2 insulins in the same syringe. And you will need to know this information both for your clinicals coming up as well as for your upcoming exam. Gently roll both vials in the palm of your hand to get them into an even suspension. Cleanse the tops of both of your vials with alcohol. Now, inject air equal to the dose of your cloudy insulin into that vial first. Then you remove the needle from that vial. Using the same needle and syringe, inject air into your clear insulin, which is your regular. Now that your syringe is in there, you want to invert your vial and touch the needle to the solution, which will be your regular, and you want to draw back the prescribed number of units for that particular patient. Once you get the appropriate number of units into your syringe, you want to take your needle out of that vial and you want to move it over and put it into your NPH. Again, now invert your vial and draw back the prescribed number of units that you need. Make sure that you do not push any of the regular insulin into your NPH, because now you've just contaminated all of your NPH insulin. Now, just as an almost final review, insulin dosages are always checked by 2 nurses. Have a second nurse tell you what you have. Do not tell them what you have. You have them tell you what you have in your needle. In your syringe and needle. Show the second nurse your syringe and the vials. Never combine long-acting insulin, Lantus or Levemir, or dilute them with any other insulin preparations. Thank you very much for joining me on this vodcast. This is Susan Knowles with Cochise College Nursing. Should you have any questions about insulin or anything else with medication math, please do not hesitate to email me if you'd like me to create another podcast, vodcast, or calculation podcast. Let me know what the subject is, and I'll be glad to do that for you, as long as I understand what it is that you would like.